clinical trials, et cetera. Is that correct?
Absolutely, yes.
No doubt.
All right. Senator Cassidy.
I will defer to Senator Murkowski.
Thank you, Mr. Chairman. Thank you, Ranking Member. Thank you all for your testimony here today. Dr. Harkins, I want to ask a question related to those who are struggling with long COVID in rural areas. As you know, my state is pretty rural. In addition to extraordinarily rural, we are also home to over half of our country's federally recognized tribes. We've got about 80% of our communities that are not on a road system, so access to care is always a challenge. But you had raised that recent CDC data marks more than 5,000 deaths from long COVID, and while long COVID death rates varied by race and ethnicity, they were the highest among American Indians and Alaska Natives. So I'd ask if you are aware of any research efforts that have been focused specifically on American Indians, Alaska Native population, and I appreciate that it may be that the challenge has just been that access to that care, whether for diagnosis, for any level of ongoing care, may have challenged it. But if you can speak to any research efforts that you're aware of, and then what your recommendations for ensuring that just more of the marginalized population, specifically in our rural communities, receive the diagnosis and then the follow-on treatment with regards to long COVID.
Yes, thank you for your question. In New Mexico also, very rural state with a large population of Native American as well. We don't have a very specific trial or focus just on our American Indian Native Alaskan population. And I think historically maybe we have not done well with research on this population. I think building a better partnership with our indigenous tribes and other tribal communities to want to help and share and listen to their input as to what is needed for clinical trials and other things in their community. I think they have to drive miles and miles and miles to come to a center, or they can't drive at all, or they don't have money for gas. Exactly. There's also the distrust of the research system, and I think coming to them, going to their communities in a partnership, and maybe talking with them or getting the other folks to, at least listening and understanding what is needed and how can we encourage their participation.
So let me ask about the opportunities through telehealth. You had highlighted HRSA's Telehealth Technology-Enabled Learning Program initiative to help train local providers to identify patients with long COVID and then to work with the coordination. In Alaska, clearly our community health centers are a critical component of our healthcare system. They really played a very key role in addressing the COVID pandemic. Can you share any examples of how Recover grantees can use technologies in perhaps newer, different ways to advance best practices, but really to allow for increased access to these clinical services, again, through partnerships, because the distances aren't going to get any closer. If you don't have roads, to your point, the ability to fly is cost prohibitive. So we're talking about ongoing access and other partnerships through perhaps telehealth and others in our community health centers.
Sure. Through our Project ECHO program, we reach many providers and trying to educate them, but I think also we need to have access for patients to actually visit with physicians in a multidisciplinary COVID clinic that's going to take a lot of other work to do, but I think having education, broadband technology also is an issue, getting that to the patient homes. But I think setting up regional centers where potentially the primary care provider that is in that community can be a partner in the learning loops, and then being able to understand the diagnosis and then take that to their patient. So I think that telehealth is really going to be the answer for educating the providers that can then bring the treatments and recommendations to their patients in their communities that are very rural, so that the provider is the treater and the patients don't have to come to the bigger academic center.
Thank you, Mr. Chairman.
Thank you. Senator Baldwin.
Thank you, Mr. Chairman. I